I'm Bartley Pickron. I'm a colon and rectal surgeon at the University of Utah and at the Huntsman Cancer Institute. So this is March at Colorectal Cancer Awareness Month, which is a time to educate people about the problem that is colorectal cancer. I've been a colorectal surgeon for about 20 years. It's what I do. It's what I enjoy. It's what I love. People ask me all the time about how I picked this field, and I usually put it back on them and say that the field picked me. It wasn't really my choice. It's just that, if this is what you do, it's what you love, then there's really no choice. You go into it. But truthfully, I had a lot of good mentors through my training, and it's really rewarding to see most patients who we work with do well long term. Most colorectal cancer, if caught early, can be cured very easily with surgery. And even some of the later presentations, patients still actually have a pretty long-term survival. We do see a lot of success stories. The big thing we always talk about for colorectal cancer awareness is that it can happen to anyone. There's screening guidelines where, if everything else being equal, then you start screening at 45. And some people need to start screening younger if they have certain risk factors. But the other thing too, the kind of the scary thing with colorectal cancer is we're seeing it in younger and younger people. And as of now, we still don't have a really good answer for why that is. So if you're having symptoms, change in bowel habits or blood in the stool or anything else we don't like to talk about in normal civilized conversation, don't ignore it. You need to get it checked out. Now, one option we do have is we have a mobile screening program for multiple types of cancers. But certainly, so anything we can do to get the word out about colorectal cancer screening is helpful. There's a lot of options out there. As surgeons, we usually try to promote colonoscopy as the way to get things screened, but there's also blood tests, there's stool tests, there's like flexible sigmoidoscopy. The theory being that any screening is better than none, but it's still really important just to get screened. I've been here for about almost 10 years, it'll be 10 years this summer. And so the experience here has been good. I was in Houston, Texas before, and there's some differences. But I think here, some of the interesting things have been with the genetic studies that have been done by the University of Utah, looking at families with different hereditary colon cancer syndromes and being kind of a part of managing a lot of those larger families that have syndromes that make them more at risk for colon cancer. Is one of the unique things that we're able to do here. It's become a lot more prevalent across the world with more education and more research about these problems, but a lot of that groundbreaking work kind of started here long before my arrival, but it's been fun to be a part of that process. So we're really excited about our new fellowship. We just were approved last year by the ACGME. So we have a surgeon who has finished general surgery training who comes to spend about a year with us learning the nuance of colorectal surgery. And it's been a really exciting time to be part of that educational process and just kind of continue to build on the already strong legacy of the training programs here at the University of Utah. And we're really proud of the program we've established here. We've got pretty much anything and everything that someone going into colorectal surgery would want. We have a very strong clinical practice. 2 of our faculty are federally funded, looking at several factors within colorectal surgery and the research that goes along with that. We have options for global surgery programs. One of my partners has done trips to Ghana to help establish laparoscopic colorectal surgery there. I've been to Cambodia, and there's a lot of options for outreach within our program as well. We have a very strong minimally invasive program. We do a lot of robotic surgery, a lot of robotic rectal cancer. We do a lot of laparoscopic surgery. We have a very strong IBD program. So we're really proud to get this fellowship started and looking forward to seeing it progress. It's an interesting place. I never saw myself living here growing up in Alabama, but here I am, and it's a really great place to live. I mean, the outdoor stuff you cannot beat. With winter sports, if you like hiking, mountain biking, camping, trail running, there's anything and everything. So it's a really good place to be. It's an easy place to live. So we've really enjoyed it. There's a lot of advice. And I think that the biggest one is that there's a lot of challenges with being a surgeon. Not everything goes the way you want it to. Not always your fault. And keep working at it. It can be a humbling profession, but definitely lean on the support of those around you to help you get through the hard times.